Welcome to everyone to Dialogue on Diversity's webinar, COVID-19 Science and Social Justice Remedies for a Battered Society, 3 to 4:30 today. I'm Maria Cristina Caballero, President and CEO of Dialogue on Diversity, and on behalf of the board of directors of the organization, we thank you all for joining us at our second webinar using Zoom. We are new at this technology, actually, and we're working to master it. But I think we're doing very well. The first webinar on April the 22nd on COVID-19 March on Women's Lives, Tech Connect went very well. And today we hope to do the same. Today, Dialogue on Diversity investigates a changing world at the crossroads of social upheavals and pandemic. We look forward to an insightful discussion on COVID-19, its economic impact and remedies, healthcare challenges, and the role social justice plays in both. Acknowledgement of my co-moderator. You've already met him, James Robb, Executive Director for Data and Technology at MSCI New York. He has been so kind to lend his talents to bring this webinar in place as our tech officer. He will also take over the question and answer session at 4:10 this afternoon, as soon as we've had everybody's presentation. And to let you all know that we are recording these webinars and we will post it on YouTube and share on social media in the next few days. We ask for each speaker to give a brief description of their organization and role as they address the topic for today's agenda. I will keep time as much as possible. As I mentioned, Q&A is at 4:10 after all presentations. We expect a lively conversation with all of you participating today.
Okay, and so as Bon was saying, we're gonna have a Q&A session later in the webinar in about like 15 minutes roughly, or an hour. And so if you wanna post a question during the webinar, you should see at the bottom of your screen a Q&A button. Feel free to enter your questions there. Also today, just to get a little bit of audience interaction going, if you want to wait until the Q&A session and hit the raise hand button, you should see a hand at the bottom of your screen. If you hit that, I'll be able to unmute you and then you can ask your question directly. If we get on short on time or we run out, we can certainly get back to you. We have everybody's emails and we'll follow up with everyone afterwards. So now let me turn it back over to Cristina Caballero for the introduction of Representative Tony Cardenas.
We are greatly delighted to present as our opening speaker, Representative Tony Cardenas of the 29th District of California. Representative Cardenas has been part of our programs on many occasions. He is distinguished by an abiding concern for the lot of entrepreneurs and for ensuring the country's spirit and entrepreneurial ethos, and a driving concern for the country's minority communities. And for this purpose, women and Latina women are a major part of this minority. Representative Cardenas is a graduate in engineering at the University of California, Santa Barbara. He has well-honed skills in the intricacies of IT technological revolution that is an increasing part of our domestic and business environment. Founder of the Crime Prevention and Youth Development Caucus and the firmly bipartisan Congressional Student Protection Caucus, along with his bipartisan efforts in healthcare, the environment, and immigration. Today, we invite him for his comments on the stressful and worrisome days of the country's now confronted with COVID-19 epidemic. He is a congressman in whom we may be genuinely proud of. Please welcome Representative Cardenas.
We got you.
Thank you very much, Cristina, and I want to thank everybody who's on this call. The topic today is incredibly critical and important, not only to the Latino community, but to everybody in this country. And since we're talking about a world pandemic, to the world.
Yes.
It's fortunate that we still live in the most capable country on the planet, but we need to make sure that we're actually acting as such. And as of right now, when it comes to this pandemic, there seems to be a disconnect between the American people and the legislature and how this White House is presenting itself. Case in point, day after day after day, even though this administration has been hinted to, asked to please send a better message to the American people about, for example, doing something as simple as wearing masks. No. And they refuse to set that example. And as such, there have been some governors and some local electeds who are following suit with that. And unfortunately, we're seeing the bad results of that kind of lack of demonstrating leadership. And some people, you know, if you want to assume that what I'm saying is partisan, then that's your right to do so. I'm not being partisan. I'm just stating simple facts. I'm on the Energy and Commerce Committee, and one of the two policy committees on healthcare is the Health Subcommittee in the Energy and Commerce Committee. And on that committee, we've been having a handful of hearings. We're going to have another one tomorrow, coincidentally enough, on mental health in America. And that, I think, is a big part of today's topic, because what we're talking about here is current social ills that are happening, that people are being affected by, and how we are able to handle it as individuals, as families, as communities, and as a country, and as a world. Yet at the same time, we also have long-time disparities that have been occurring for whether it's generations or hundreds of years, that we have yet to solve or heal from those kinds of issues. So it's really important that everybody understands that life is complicated on the normal. Today, when it comes to a pandemic, and then also when you compound the beautiful awareness that's going on in the United States of America when it comes to people of color, when it comes to discrimination on, quote, the other, and it's time that we actually have more laws and more actions that are actually going to make the difference. I'm very excited at what we're seeing with the protests and people actually exercising their constitutional rights to freedom of speech and to exercise the right to come into their public spaces and actually act responsibly and non-violently, to speak up. Yet at the same time, I warn all of my American friends when we get into that conversation, say, wow, it's happening. Wait a minute. The beginning of the awareness is happening. That's beautiful and it's amazing. And it's only happened a few times in America, that portion of it. Now what we need to see is we need to see the follow through. For example, just today it's been announced that the legislature passed a bill that they're going to redesign their flag in Mississippi. But they're going to take the Confederate flag portion off of their flag and they're going to redesign it. That is something I think, quite frankly, everybody on this call probably wanted to see happen. But honestly, I don't think, if we were honest with ourselves, if somebody would say, is Mississippi going to change its flag? Are they going to get rid of the Confederate portion of that flag on their flag? I think that everybody on this call would have said two things. I would love to see it happen. I don't think I'm going to be able to see that happen in my lifetime. What a beautiful event today to see that happen. However, let's get back to policymakers like myself. That state legislature passed it today. The governor says that he's going to sign it. That's music to our ears. But at the same time, at the federal level, we need to make sure that we keep passing laws and that we keep being mindful of making sure that we hold everybody accountable up and down the chain of events to make sure that every penny that we sent out to local communities, to hospitals, to local governments, to every factor out there, that they're actually using it responsibly. Because even though we've actually put money out there in the trillions, we don't have enough to do everything that needs to be done. So we need to be efficient, we need to be diligent, and once again, we need this administration to hold everyone accountable, to hold themselves accountable, federal departments, to hold local jurisdictions accountable, to hold hospitals, etc., because we do not have enough resources to do everything that needs to be done. So what we do needs to be done right. So accountability is a big part of us getting through this pandemic and getting through this crisis in a way where we have the least amount of pain and the least amount of negative residual effect. So I'll just leave it at that, and I'm sure we're going to go to question and answers. And thank you, Cristina, for inviting me once again.
Well, our pleasure, Congressman Cardenas. That's amazing. Thank you so much, Congressman Cardenas. We look forward to seeing you again, inviting you, and a couple of other forums and webinars that we're planning, and for finding time in your very busy schedule to be with us today. Our next topic, which is part of the webinar today, is the first of social and human effects of the virus, recovering in the offing. I'm happy to introduce Deborah Berlin with the Future Privacy Forum, Consumer Policy Solutions. The floor is yours, Deborah.
Thank you, Christina. And thank you, and pleased to join others on this panel, esteemed colleagues.
Yes.
And I will tell you a little bit about all of my hats that I wear.
Okay.
I have several different perspectives that I want to bring to the table here. And as you mentioned, the Future of Privacy Forum,
Right.
where I just was named a senior fellow, and I will be working with FPF on projects related to aging and privacy. I also have a project, which you'll see on my first slide, project to get older adults online, which
Nice.
focuses on promoting technology for the older adult population. And so as we look at this crisis that we are in right now, I want to focus on one particular community that is very much impacted, and that is the older adult community. For over 10 years, I've worked on Project Goal, which is focused on this community. Prior to doing that, I worked with AARP. So I'm very familiar with the aging community. Since this pandemic started, I've drafted a number and published a number of op-eds that has focused on the issue of older adults and technology and what is going on right now in this crisis. So I want to focus my remarks on this issue. So over the course of the next 15 minutes or so, we'll provide that picture of this diverse older community and what's going on. Can we start the PowerPoint, please, James?
Sure. Yeah, it's coming up now. Let me know. You should be able to see it now. And it's shared.
Okay, there's our first slide. So let's go to the next one. So here's a little bit of background on older adults. Older adults, 65 plus, encompass 16% of our population right now, and it's a fast growing percentage of the entire population. So let's get a picture of what this population looks like. There's also about 1/4 of women age 65 plus who live alone. And as they age, that increases to about 55% when they turn 85 who live alone. What I want to do is give you a picture of who actually is in this COVID-19 community that is most vulnerable to the pandemic. Life expectancy is lengthening, as we know, and that's driving more elderly into nursing home care. In 2017, there were 1.2 million older individuals, elderly, in the nursing home care living situation. So that's what we have had as background. Now, could you turn to slide 3, James? Thank you very much. So what has been the impact of COVID-19 on older adults? Well, as of May 7th, and actually I checked this today, there has been no change in this. 8 out of 10 of the coronavirus deaths have occurred in those age 65 and older. We know it's our most vulnerable population. 1/3 of those deaths have occurred in nursing homes and long-term care facilities. Older individuals who are living not necessarily in nursing homes, but in assisted and independent living facilities are in a state of lockdown. So they're isolated from their support network. They're isolated from family. They're isolated from friends. They're basically staying in their rooms. And the balance of others who are older adults are in a voluntary state at home situation, trying to maintain health and stay away from the virus. So that's our situation that we are currently in. So these are all pretty striking numbers. And it equals a very isolated situation. So what are we doing in this isolated state? James, can we have the next slide? What's the game changer for all of us? Older, younger, all ages. What are we doing to counterbalance this increasing state of isolation? Well, we're looking to technology. So no big question here. Technology has been the game changer during this pandemic. It has reduced the entire impact of our situation. We've been able to shop online, get groceries delivered to our door. Education has moved from the school to the home. Entertainment is entirely a question of getting it at home, streaming TV shows and movies. Our news and information is entirely through our tech devices. And telemedicine has now brought the doctor to home as well. So our doctor visits are online. And our family and friends have also been connected through video chats and social media. So everything that we now have used to do outside of the home has moved inside of the home, and we've relied on technology to do that. So it's been the biggest game changer for all of us to help maintain the life that we had before. I didn't mention in my list here, probably the number one for all of us that are, what are we doing right now? We're working. So that's the other number one activity that we are able to do and maintain, is we've been able to move our work to home as well. So all of these regular daily activities that we have been able to do to maintain some sort of normalcy have been due to technology. And we do that through a broadband connection and rely on that. So can we get the next slide, James? So here's how we connect during COVID-19, and this will look very familiar to all of you. Next slide, James. Here it is. This is the Zoom event for 2020. This is how we communicate. This is a Zoom party. So we have our parties, we have our gatherings, and yes, even weddings. You've seen them posted. I saw one from a friend of mine this past weekend who got married and shared it on Zoom. So the video opportunities are endless and have been commonplace events during the pandemic. Let's go to the next one, James. But what if you don't have a broadband connection? What if you are not able to connect during this time? So that isolation that I talked about before, and the congressman was right on when he talked about mental health.
Exactly.
Because if you don't have any way of connecting and you are isolated, it is a very difficult situation during this pandemic. So that isolation increases if you don't have a way of connecting. And there is a tremendous digital divide among our older population. Only about a little over half of the over 65 population have a broadband connection at home. Now about 67% use the internet. And this is based on a statistics from Pew that were done about 2 years ago. So it may have notched up just a little bit. But if you look at that 67% of internet use, that was the difference there between the 50% and the 67 was probably folks who went to the library to connect or connected in a senior center. And if you think about this pandemic, all of those opportunities are closed right now. So it's really anyone who connected outside of the home cannot do that right now. So you have to have that in your home. Other statistics of interest, and these were from an AARP survey that was done earlier this year. About 62% over 70 have smartphones. About 47% have tablets. And then this is interesting. I thought it was much higher because they're so popular, but only about 12% have those home assistants, things like the Amazon Alexa and the Google device, which is very similar, where you go, hey Google, which are really, great assistive devices. So those sorts of ways of connecting from home, which help you to talk to family and friends, visually see them and connect, have those video chats, participate in family gatherings. Almost half of older adults don't have that opportunity. And as the older population gets older, the numbers radically reduce. So the older an individual is, the more isolated they are going to be during this pandemic.
Mm-hmm.
Thank you. James, the next slide. So what do we need to do? Where is this road to recovery, as Christina asked at the beginning? What do we need to do? Well, it's time for Congress to help close this digital divide. And, I'm getting ready to close, Christina. I know we need to move on to our next person, but it's really time for Congress to do what it needs to take to close this digital divide, to address these issues, to make broadband more available and affordable to the unserved, those who are in the rural communities, in areas where there is no broadband, where access is an issue, as well as the underserved, those who are in urban areas but still may not be able to get it, low-income individuals. So it's really important that we close this digital divide, that we get our older individuals connected and others as well. It's time to make that happen and reduce the isolation factor. This pandemic has really revealed the haves and the have-nots, and we need to equal the playing field for all and make sure we close this divide. So thank you very much.
Well, thank you, Deborah, for providing us an opportunity to find the recovery to our issues for the minority and majority population of our community, especially the elderly, that are actually not in the picture at all, because they're always talking about the younger population, but the older populations are the ones that vote. They're the ones who have something to say about where our world is going. And since I'm part of that crowd, I'm very much involved in how we can recover, with our community, the older population who are definitely not counted in many ways. They're the silent majority, I say. And thank you, Deborah. And now it's time for the next topic where it is safe and efficacious research is on. Dr. Adrian Grover from Patient Privacy Rights and Chief Technology Officer is on. Thank you for coming and enlightening us, Dr. Grover.
Okay, is my screen showing the slides? Yes?
Yeah, we can see it.
Okay, great. So thank you very much, Christina. I'm glad to be here again and give a sort of medical and medical technology perspective on what's going on. I want to start with a 2-minute video by way of background around the coronavirus to sort of set the table for the various policies and what is meant by safe and effective, and relate that to the science. So let's hope this shows, and you can hear the audio and everything. Okay, so with that, let me go back to my presentation. I'm the Chief Technology Officer for a nonprofit, the Patient Privacy Rights Foundation. And my role is to basically participate at the interface between policy and technology. Let me start then with what's the difference between COVID-19 and the regular flu. In general, COVID-19 is caused by, right now, what people consider only one virus. We hear about mutations, but we don't really know their significance. And we have symptomatic treatments for both. I'll mention a little more about that later on. But the ones for the flu are not known to be particularly effective, and the ones for COVID-19 are still evolving. The big difference is in the numbers. The flu is not a reportable disease. Doctors and labs are not required to keep, to announce these things to the public health authorities. So it's very hard to compare things like mortality and other aspects of the COVID-19 with the flu. The part of the related thing with reportability is contact tracing. In the case of COVID-19 right now, contact tracing is really far and away the most effective thing we can do by way of prevention. And the big differeces that we'll be mentioning a little bit later between different countries, for instance, are due to the way they manage contact tracing. I will also talk a little bit about vaccines, and if you're all waiting for a prediction as to when a vaccine will be available, I will not be making one. Very few technical or sort of health people are willing to make a prediction on this. It is certainly not by anybody's measure, including the politicians, anything that's going to happen before the end of the year, however. And obviously, the difference with the flu is that the death rate is substantially higher, and I will talk about that. One of the things that we do want to sort of focus on is what can we do to keep the virus from winning. This is an excellent series from the New York Times. It sort of shows, in detail how the disease spread initially from the West Coast and the East Coast, where on the East Coast it may have been due to travel from a different direction. And this is really what you want to focus on in terms of COVID and the spread, which is that at a point in time, and this happens to be February 15th, when the number of cases is literally just a handful, I think 15 was the number here, the actual number of hidden infections at that time was already what you see on the chart as well. So it is this characteristic of the virus that makes it spread silently through what's called community spread that really drives the big difference and drives a lot of the policy and the work around COVID-19. So a week's difference in how social distancing measures are implemented and how effective contact tracing is at the wrong time in the epidemic can mean tens of thousands of deaths. Okay, so I was asked to talk from the perspective of what is safe and effective, and I split it into basically 5 categories. I'll go through them quite quickly. Testing and treatment, safe and effective contact tracing or isolation measures, vaccines and vaccine distribution, aspects of racism and globalization, 2 sides of the same coin, and then what we could do in terms of fairness and politics going forward. On the testing side, there are basically 2 techniques, swabs and antibody tests. The swabs are the gold standard right now because antibody blood tests don't really tell people whether you are infectious at that particular time, and they will keep getting better. On the swab side, the problems have been, a very large number of false negatives. Initially, it might have been as high as 30%, depending on how the testing was done. And I don't have more recent numbers. And also, if you're going to test people like employees or health workers, how often do you do that? Is it once a week? Okay. On the treatment side, we basically have heard a lot about ventilators. Today actually was the first announcement of the remdesivir as a treatment that's certainly not a cure, but it seems to take about 4 days off the course of a hospital treatment. And we don't have information yet as to whether it affects the death rate. And then one of the most important things, which I urge all of you to look into, is what's called convalescent plasma, which is the ability for people who have been infected to donate plasma. It's kind of like a typical blood donation process, which will then, after being sort of tested and purified, might help treat 3 or 4 other people. It's a very important thing. Next slide, please. Okay, on the next category is what can we do by contact tracing, social isolation. To some extent that involves technology, but it's mostly just legwork and good policy in terms of when to reopen and how to staff up public health capability. And this is just a startling graph. You'll have to, I know it's a very busy thing, but what it's basically showing is how the death rate in the European Union was literally half of what it is per million people in the United States, simply because they were better organized and better prepared to deal with contact tracing and social isolation. Of course, a country like South Korea that's near China and has had to deal with SARS and swine flu and whatchamacallit, I'm blocking on it, before was able to do a much, much more effective job. You know, their death rate from COVID, even though they were hit much earlier than Europe and the US, it was much lower. Next slide. Okay, did we skip one? No. Okay, so on the vaccine and vaccine distribution side, it's a long haul. And there are about 140 vaccines altogether in various phases of trial, and none have been approved. 3 are in what's called phase 3 trials. And remember, even after phase 3 trials happen, it's going to take many months to crank up production and distribution. Next slide, please. The challenges to a vaccine is safety. If you're, you know, it doesn't take too many vaccine-related problems to overwhelm the benefit of whatever the death rate and challenges of a virus itself. So that makes it very touchy. Long-term protection and protection for older people, which generally don't respond to vaccination as well. And we heard Deborah's presentation about how important it is to protect, you know, to be judged by the least privileged in our society. All of that sort of reduces the hopes we can have for a quick vaccine solution. Eventually it will happen, but it's not going to be right away. Next slide, please. On the racism and globalization slide, this is just an incredibly startling realization. Yes. That the 3 color bars refer to Black, Hispanic, Latino, and white Americans, both in terms of by age group and age adjusted rates. And you can just see this amazing difference, which is not attributable to some genetic or inherent situation. It is almost completely due to social determinants of health and access. Next slide, please. This is, again, a little bit technical, but what it's basically showing, and this is, you know, this is the slide I was looking for before. It's showing you that the peaks are occurring at different parts of the world at different times, separated by approximately 2 to 3 months. We're seeing that, for instance, in Asia, the peak is just about hit. And what that means is that we're subject to having multiple waves because we do have global travel and the way things work. When you have this kind of behavior where there could be 4 or 6 months between for the pandemic to spread around the world, we can never be too careful about the measures that we use for isolation and contact tracing. Next slide, please. Finally, 2 slides. One of them is when we talk about safety and effectiveness, which are terms from the drug regulation industry, we, in this case, have to ask for who. And, you know, there's been a lot of discussion, and I'm certainly not going to get into it, about, you know, that involves nationalism and politics and just introducing aspects of fairness in terms of the social determinants of health, which are really integral to the conversation of who are we as a country and as a people in terms of safety and effectiveness. And the last slide, I believe. So, yeah, I think that's basically my presentation. If you reach out, please, if you want to know more about what patient privacy rights is doing. Thank you.
Thank you, Dr. Adrian. You covered a lot of areas. Wow. we have to follow through with all the research that you've already done. Fantastic. And racism is one of the topic areas that we face in our country today. And yeah, I don't know what to make of it, where we're going, where the rules are going to be effective for whom and for where. And I guess the world is not one nation, it's all of us at one time. And thank you for that safe and effective hope for dealing with a pandemic virus. So finally, here's Nicole. And finally, we'd like to address our last topic, new imperatives for the economy of decency. With our good friend, Nicole Turner Lee, Senior, Brookings Institution. The floor is yours, Nicole. Well,
And I'm
plenty to tell us. Yeah, plenty. Come on.
So thank you, everybody. And I'm sorry I wasn't able to be on earlier. I've just been back to back with calls. Two things I want to announce. First of all, we all love this lady who continues to put on, I think, some of the best conversations affecting people of color over the last few years. So Christina, thank you for all of your work when it comes to this space. And the second thing I want to commend her on is the fact that she was able to bring us on a Zoom call. Because you know, Christina is a up close and personal person when we sit around those round tables talking about this issue. Want to acknowledge also the congressman. I see him on this call as well, who's doing great work, I think, to continue to advance the issues related to African Americans and Latinos. So thank you, because you're someone that I admire as a huge role model in this space. I want to take my time, and for those of you that don't know me, I'm now a senior fellow at Brookings, who was just appointed last Friday to the director of our Center for Technology Innovation. It's a huge accomplishment in the issue of race relations, because I'm one of you at Brookings, runs a center that's not prefaced with something of color, right? That actually is on the new economy. And I'm excited about that role, because I think the issues that we have discussed within this roundtable over the years have shown the growing evolution of digital technology in ways that disproportionately impact people of color. And we're now at this moment, and I want to say to Dr. Groper, your slides in terms of the disproportionate impact of COVID on people of color, and that slide I think came from a colleague of mine at Brookings who wrote about the health effects. You know, as a person who's been working on health disparities for communities of color dating back to when I was at the Joint Center for Political and Economic Studies, what COVID revealed in many ways was the really the ugliness of our country to deal with adequate and sufficient care to people of color and low-income people. And the fact that it's not just, you know, that those social determinants of health were factors, but also the fact that people live in segregated or dense housing, in addition live in places where there are food deserts and have inadequate access to or trust within our medical systems, is really, I think, speaks to the shamefulness that we had with having a disproportionate number of Black and brown people die within a 3-month period in ways that we've never experienced before, as well as older Americans who were much more vulnerable to disease. So we have a lot to do in that space, and I think at the end of this, we need to unpack what that actually looks like going forward. But in addition to that, you know, I tell people 2020 was a year when the lid was actually pulled off on a lot of things that were sort of hiding underneath the surface. I would be remiss if I didn't say this, that we're also in a stage where racial unrest and civil unrest, something that has always been a settled determinant of health in many respects in terms of public health, actually revealed itself in the recent egregiousness of law enforcement, as well as the fact that, you know, even these conversations on monuments have a lot to do with this pandemic of racism that exists and who's included and who's not included. And then I would suggest the thing that I focus more so on is on digital health and the pandemic of digital divide and what that actually looks like going forward. The call that I was just recently on, I had to stress to people that 53 million school-age children were not in school as a result of social distancing requirements. Out of that, about 12 to 15 million of those kids did not have broadband access. And those that had some level of broadband access, about 35% of those kids had one device among multiple siblings and a working parent. So when you think about 4 kids in a household, one device, 12 to 15 million kids without any broadband, that in and of itself is another equity issue that we have to solve, because the new economy is essentially pushing in that direction as to the extent to which people have access before them. And that's an equity concern, much like the other concerns that we're talking about with healthcare and, you know, equity around the policing of certain communities, et cetera. So again, I think going forward, these are big issues, right? And there will no longer be a new normal the way it was. In fact, I tell people maybe that's a good idea because the new normal wasn't that great because these issues were sort of buried under the ground. But going forward, what does that mean? And I think Christina has charged me to do a couple of things, which is to sort of talk about the digital ecosystem, but then also talk about, I think, the wraparounds of misinformation and disinformation that come with it. First and foremost, we are all now highly dependent upon digital for our points of conversation. As someone would say, it's a new public square. As you all have heard me actually at Dialogue and Diversity talk about the growing public square of discourse that happens online. The FCC tells us that about 20 million people are not online or connected. And some would suggest that that number is actually maybe even higher, upwards of 100 million people who lack some level of connectivity to broadband. When you ask yourself, why do they not have access? Obviously, the first part of it is just not accessible. They live in a rural community where there is not last mile or middle mile connectivity. They live in an urban community where the cost of broadband is way too high, so it's not affordable, or they don't have competition. They're dealing with one or two providers, and those providers sort of monopolize that marketplace. When you look at the accessibility of broadband, there are people who somehow don't have broadband because they don't even know what to do with it. Shameless plug, I'm writing a book on this that comes out in 2021, which is about the US digital divide. And what I have found is that we as digital natives seem to think that everybody is connected when in actuality they are not, right? They are digitally invisible. We don't see them and they don't see us because they don't participate in the public square. And as the analog society continues to die, what happens to digital? It grows, and those that were not connected, like Michael Harrington said in The War on Poverty, the people who were so impoverished that they fell off of the unemployment rolls and other roles, what essentially happens is we don't know what their needs are and they cannot be taken care of. So I'm really sensitive to what Adrian talked about with the social determinants of health and the health disparities that exist among Black and brown people. Because now we have this chance in the digital ecosystem to offer things like telehealth that will potentially, because most people of color have a higher likelihood of having smartphones and mobile devices, will maybe be able to now talk to a doctor from the middle of a housing project or in the middle of a rural community, a farm, in ways that they could not go to a doctor before. And so I think that those are, I think, some of the promises that have come out of COVID-19, our ability to sort of ride off of the heels of digital connectivity, the necessary digital connectivity that we all needed to have, right? That we should actually keep versus reverse what those trends are. So for the congressman I know who works really closely on commerce issues around the digital ecosystem, we need to revisit what worked in terms of connecting individuals. What were the use cases that were most effective? Did it help workers? Did it help us in healthcare? And let's try to keep those trends going in the upward trajectory, particularly as it explores our ability to close equity gaps. But in those areas that didn't work, our kids being offline, our kids having an educational meltdown and failure in terms of remote access, we need to go back and look at what that looked like as well. In terms of what worked in showing George Floyd, the ability to have smart devices that actually brought into the living rooms what actually happened to him and Breonna Taylor and others, that worked. Now we have to solve the policing issue so that we never have to see those images come into our living rooms again. And I think on top of that, and I'll just sort of, again, because I'm known for going over, so Christina, I'm going to keep to my time this time. I'd like to sort of share where there are other challenges going forward. And then in particular, that would be, I think, in this area of disinformation and misinformation. So we have these opportunities that actually exist with being connected, and then we have these equity challenges with being connected. But on top of that, we have a layer of information flows that now can determine whether or not we go out and vote, can determine whether or not, and I love the way Adrian talked about it, we decide to be part of a contact tracing network based on what people will do with that information going forward. I was sharing with somebody some research I'm interested in doing, which is, do people of color actually opt into contact tracing? Or are they more afraid to opt in because it may actually create a profile or picture of your less worthiness of being insured? Because you now belong to sort of a geofence network where people may say, well, if I tell people that I'm exposed, my insurance company may raise my premium. So these are things that I worry about in terms of managing privacy under public health surveillance. But I also think that, we've already been down this road of disinformation and misinformation before. And some of you who are watching may be familiar with these recent calls around Section 230 and the Communications Decency Act, and whether or not there's any recourse for people who feel that there's conversations or communications that are somewhat objectionable when it comes to its placement, again, in this new public square. There's a case to be made on both sides, right, when you look at that. In 2016, under the presidential election, the manipulation by foreign operatives to send messages to voters that were more marginalized or more likely to be disenfranchised by traditional voting suppression happened. And we know from Pew that it wasn't a widespread voter suppression, but there were hints that some people stayed at home based on the fact that they saw ads of, you know, former presidential candidate Hillary Clinton, her face darkened or looking meaner, simply, or being sent out to protest that were not necessarily organized by Black Lives Matter, but by some Russian operative group. The same thing was said, believe it or not, in the George Floyd protests, where we actually saw appearances of white extremist groups showing up at places, or people of color showing up at places where there was no affiliation with Black Lives Matter. And the internet continues to be sort of like, I tell people, that ocean where if you're a fisher person, like I am, I have to say fisher person because my partner is a fisherman and I'm like the fisherwoman. So we go out there, we stay for real long periods of time. But if you're like a person who likes to fish, when you cast your net, the internet now is a net that can be cast over millions and millions of miles. And it can go deeper and deeper in terms of surface information and things that are much more opaque for even legislators to actually track. So in the George Floyd protests, believe it or not, disinformation and misinformation was rampant about, you know, just pitting people against each other. And according to the president, misinformation and disinformation was waged against him in terms of, you know, what was being said to him and how that was actually being managed by our social media companies. I err on this side with regards to that. I know that the Congress just had a hearing on Section 230, which again has historically been sort of the backstop of tech companies to allow them some indemnification from any type of direct liability for what other people post. But the challenge there is, what do you do when you have an administration that is feeding into the violence and the polarization that is not necessarily healthy for this country? That is suggesting in many ways that they want to use those platforms to not unite us, but to essentially incite violence among certain people. And we saw that in ways that many of us even had to explain that to our children, what was going on. And so I would suggest, as we have these conversations, and given my limited time, we need to talk about what the role of social media companies are in our democracy. And as people of color, particularly those that are affiliated with Dialogue and Diversity, have a conversation around the role of racial justice and how that looks like under telecommunications policies. I say that because some of us are not even involved in these conversations. And I know the congressman can attest to that. We don't show up in these conversations as people who represent marginalized groups. And we need to get up to speed on these issues, because these issues are being debated in ways that they're being used to manipulate and exploit our own vulnerabilities that we have fought long and hard to, you know, ensure that we have civil and human rights that wrap around that, so that things like voter suppression online can be litigated based on the fact that we've already sort of gone through and settled the Voting Rights Act. You see what I mean? It's almost like a reversal. The internet in many ways has reversed some of the trends of civil and human liberties that we fought for years, and our forefathers have fought for. So I would just suggest on the misinformation and disinformation, former Ambassador Karen Kornblue published a paper which I thought was interesting, and I'll close here, which suggested that in this area of misinformation and disinformation, it's important for us to go back and reconsider the lawfulness of what's actually happening and being debated online, and perhaps, as I've suggested with algorithmic discrimination, that we update the civil rights laws to ensure that they explicitly apply to the digital ecosystem. And so that when we see things that flag unlawful behavior or behaviors that actually trigger civil rights and civil liberties violations, that we have some place to actually have that conversation. I think that civil rights groups also need to be directly involved in the conversations around Section 230, because the same type of, I was once at a meeting with several conservatives, because I have friends who come from all different persuasions, who were so upset about the conservatives' voices being quelled on social media. And I said to that person, I said, now you go back and ask a Black Lives Matter person if they feel the same way. To which they responded, I guess they would, right? Because the algorithm is so powerful that it actually demands in some way scientifically that type of polarization. So I think, again, communities of color need to be involved in these conversations that in some way may impede upon our free speech, our right to protest, our right to engage in dialogues that actually were emboldened by civil and human liberties. And then finally, I would say this, and this goes back to my original point about the digital divide. None of this will make sense unless we're fully connected. None of it. The fact that we still have high penetration and pass-through of tech, fiber and wireless, but we have lower penetration when it comes to communities of color, we still have to work on that. Because this new public square will be the determinant of new policies, as well as new programs that we will or will not benefit from simply because we are not within the. And so I have so much more I can talk about. Congressman, I see you opened up your mic there. I don't know if there's something you want to contribute, but I think all of this is so important going forward.
Thank you, Dr. Turnerly. It's good to see you. They just started voting on the floor. Although I'm not in DC, I still have to participate with my proxy process. So James, is there anybody that had a question specifically for me before I got to go?
One interesting question that's here, and ask real quickly, and since you're about to vote, like maybe this is particularly appropriate. So you know, traditional economic policy agenda approach to crisis, right, is to pump massive amounts of liquidity into the banking systems. Now, in much the same way that, as you mentioned in your opening remarks, you know, things that we thought would never happen are starting to happen. Do you think there's an appetite in the legislature for deeper economic structural change?
Yes, absolutely. But the answer to that question is, with some of us, there is. And with others, there's not. And one of the things, the disparity that happens in Washington specifically, when it comes to funding, when Wall Street needs help, all of a sudden, my colleagues on the other side of the aisle want to jump to it and say, we have to help them. Remember, too big to fail? But on my side of the aisle, what we tend to look at, let's look at the entire ecosystem, but let's specifically look at the individual worker, the individual household. And the fact of the matter is, when Wall Street, I use this example. If you have somebody whose net worth is $2,000 and they lose 50% of their net worth overnight, they're down to $1,000. To live in America on $1,000, you're not doing too well. But if you have somebody whose net worth is $60 billion, and literally overnight, they lose half of that, right? They're down to $30 billion. Both parties have reason to complain or be upset or bothered or whatever. They just saw 50% of their wealth disappear. But to the person who's down to $1,000, they might not be able to have a roof over their head next month. But the person who went from 60 billion to 30 billion, believe it or not, they're in much, much better shape to not worry about the basic necessities that the average American has to work for. And to me, that is the disparity between the debate that's happening coming from my Republican colleagues. When it comes to Wall Street, they're all up in arms. They think we need to do things quickly. But when it comes to Main Street, when it comes to the individual single mother who just lost her job and has 2 children she's been serving for and helping, that person is in a dire situation. And the two require different levels and different kinds of attention. So yes, there is an appetite to pump money into the system, but there's two distinct ways in which some of my colleagues look at it and some of us look at it. So with that, I apologize. I do have to go vote. Thank you so much, Cristina, for inviting me. Appreciate it. To all the panelists, thank you so much for being on here. And I loved your information, Mr. Groper. And then also, Berlin, thank you so much. You shed some more light that I'm going to take to heart when I do my legislation. So thank you. And always good to see you, PhD, doctor. Thank you. Take care.
God bless you all. Thank you so
God
much.
bless you. Thank you.
Congressman Cardinal. Well, it looks like we've got more questions, I think. James, is that true?
Yeah, so let's go through. One thing I wanted to let people know, so now's the time. If you have a question you want to ask, you can go into the raise hand section, and then I can click on the thing to unmute you to allow you to ask your question directly if you want to. So feel free to do that now. In the meantime, we have a couple of questions out here. And you know, interestingly, this is a question for Nicole. So it relates to technology and penetration into ethnic communities. So technology may be a big part of communities re-engaging with one another in a COVID world. So for instance, things like hotspot detection, contact tracing, right? So in that context, are there systemic issues that we need to tackle to ensure that minority, diverse, and less affluent communities don't get left behind?
Yeah, I mean, I think we do. I mean, I think we have equity concerns. We have equity concerns that we have to address, whether it's equity concerns around the availability of infrastructure. So who has access to what, right? And what's the speed in which they have access is equally important, particularly when you look at these new applications and services. The second thing is, what's the device that people are using? You know, people sometimes think that a smartphone is the answer to everything, and to a certain extent, it can be very helpful, particularly like I mentioned with telehealth. But the challenge is, if you are a young student who's trying to write a research paper and you do not have access to a device, it's just not going to work. And so going forward, it's kind of like on this call I was just on, someone said, we've always known that there's a digital divide, and it's always been 7th on the list of 10 things, right? And even with COVID, where it's now #1, we still don't know how to make it #1, right? It's still somewhat 7th because it's something that people have less knowledge around. So I think we need to raise the awareness of the impact of not being connected, not just on you know, the bigger buckets of supply and infrastructure development, but really, what are we empowering people for? And so, you know, again, some of you heard this in my book, you know, what I found is that people are carrying around technology all the time, or they have access to some level of connectivity, but yet they still live lives where the quality of life is still affected. It's still not where it's supposed to be. And so we're doing something wrong in this country. We actually think about, you know, the access to digital and the improvement of our quality of life and the improvement of the systemic inequalities that have fed into, I think, the disproportionate access that people of color have. So yes, I just think that we got to do more to make sure it's equitably deployed. And I see Deborah here, you know, not just to people of color, but to older Americans who, you know, by the time they are over, what is it, Deborah, 80, they're pretty much written off. And these are the spaces that we need digital access the most, because we need people to age in place among family members, right? So.
Right.
So,
Right.
oh, Deborah, you're going to say, please.
No, I was just, thank you, Nicole, for recognizing that. And I was going to congratulate you, Nicole, on your wonderful new position. So I wanted to say that. And also, you know, I don't know if you caught my remarks because I was first, Nicole. I don't think you were on at that point, but you know, I made the point when you say I don't know how to get this issue up above #7. But I think what is not really recognized with this issue of not being connected is how it impacts individuals who are not connected. It's not just not being able to do certain things, but it's also the impact on health and mental health. That's what we are finding. It's really that impact which has been so devastating during this time of the pandemic. So I think that may be how we can raise it up a little bit, because that's what I'm finding with the older population is that impact on health and mental health has been so critical.
So I want to double down on what both Nicole and Deborah are talking about in terms of the digital divide by pointing out that there is another kind of structural racism built into our system, which has to do with how we collect data and how we measure the things that are going to drive policy. What I just put into the chat is a link to a very short article from about a week or two ago about how health records are being used to, in effect, hide structural racism involving the social determinants of health and the kind of treatment that, for instance, leads to maternal mortality in Black populations being just, even before COVID, being just multiples of other racial groups. And so the thing that we could do, in my opinion, is to give people control not only of cell phones that are connected with broadband to the internet, but give people control of how the data about them, the health records and other records about their social situation, which are very, very private, how they are analyzed. Because what we're seeing right now, and you can read a little bit about it, some links in my article, is that, for instance, 22 states out of the 50 are not collecting certain kinds of data about COVID-19 that would be useful in determining policy, for instance, social isolation, employment practices, who gets PPE, who gets childcare, and things like that would impact their communities. They're just not collecting the data. And the way to deal with that digital divide, because it is obviously a digital issue, is to give individuals the individual ability to steer and align with community groups that they trust, whether it's a church, whether it's a political group, and doesn't even have to be local, so that we get many more eyes, much more open data on the policy infrastructure. And I'm actually curious whether either Deborah or Nicole, who are much more on the policy side from this perspective than I am, whether they think that we should be doing something about data access and analytics as they inform our national debates.
Yeah, I can speak to that first. I think that you're completely right. I mean, I think that the absence of federal privacy legislation in this country has placed us at a huge disadvantage when it comes to the collection, the sharing, and the processing of data, how much data we keep in this country. All of that is not defined given the absence of any kind of policy framework that suggests, what's acceptable and unacceptable forms of use. And I think that people of color, it is so interesting, Adrian, that you say that, because, I think people of color, particularly when you look at the social determinants of health, there's the systemic consequences of living in a certain type of neighborhood or having a proximity to a certain type of healthcare access, right? But then there's also this historical underpinning of how people of color, in many respects, have been exploited for their DNA and their information in ways to actually create, vaccines like Henrietta Lacks without any compensation, or be injected with vaccinations or test vaccinations like the Tuskegee experiment that leads to long-term consequences. And it's so interesting because just in the news just recently was about the fact that the US has put out a lot of fake antibody tests. And I'm curious, in the absence of data, what communities were the ones most subjected to that? Because what we do know in the racialization of this disease is that your charts show who was getting it or more likely to get it. And because of the absence of any type of framework, it leaves it to be the Wild West when it comes to the types of health products and services that you could impose upon medically vulnerable groups. So I do agree with you on that. And I honestly would say to anybody, I don't know if I trust my data with community groups at this point until we come up with a rational framework for the use of data, from both, government, private sector, as well as nonprofits going forward. I think people need to be empowered to understand that your data is your new currency in the 21st century economy. And if you understand that it's a currency, it's under lock and key, to your point, right? For not just whether or not you call a ride sharing service, but whether or not your data is used to make determinants about whether or not you get into a healthcare program or not. You see what I mean? So I think we just have a long way to go, but I completely agree with you that we're absent of a framework to actually help in protection of that information.
Yeah, I just want to mention one thing, since you said you don't necessarily know that you trust community groups. I agree with you, but the way I think about it may not be right, but the way I think about it is at least you get to choose who
True.
you get your advice from and who gets to analyze your data. Whereas right now, the structural problem is that it isn't one person, one vote when it comes to data uses.
That's right. That's right.
Some people have a lot more votes than other people. And at least we could head in the direction. We still need experts and we still need academics, but at least using the power of our chosen communities, we get to amplify our votes.
That's right. And if I can real quick, I don't want to take over time, James, but I think you hit it in terms of my mistrust. I think because of the polarization and diffusion of information across verticals, misinformation makes it so hard for people to even understand who's on their side, right? And so I agree with you. I was telling somebody, I'm not old, Christina, the hair makes me look younger, but I was telling my kids, like, we have such a different society today, right? Yeah. And we have so many different challenges because we have so many different echo chambers in which we either find ourselves or we're listening to. And so being a person who's a sociologist who believes in the power of asset building, that's kind of where I was trained in terms of asset mapping and asset building and organizing. I think you're so right? I think we need to just start looking at, to your point, what does community look like to people, going forward? Because I think we've lost some of that, along the way.
We have another question here, and it kind of relates to this topic, right? So about the owners of information having an inequitable share of power, and in particular the underlying individual healthcare information, but it relates to what will become future access to travel. So Dr. Groper, what do you think that do you think that immunity passports are inevitable? And to that end, how would they work in practice? Like what authority would issue them?
The answer is absolutely yes. Because it is science. It is not discrimination to apply science properly to what one does. And this was discussed a month or two ago by many ethicists, and I'm not one, so I don't want to go into it. That's why, for instance, we have all these calls for testing. You can't do testing without either inherently asking people to share those results if they know that they're endangering either a friend or a family member or a fellow colleague employee, and certainly you can't get past something like COVID with the rate of death that it has and disruption without doing testing. So the short answer is right now immunity passports are impractical because the testing is so bad and so much of the science is still unknown. And I'll leave it at that. But no, I don't see any reason to think that whether it's travel or employment, we're not going to have an increasing amount of testing and interpretation, specifically by physicians, for example. It doesn't have to be black and white. Remember, it's all a matter of statistics, all of the social isolation. What is it? It is the intersection between the science we know today, which is different from last week, and the things we could do economically and with the least disruption for the buck. And so you don't have to have perfect testing. You do have to be able to choose and trust who's going to interpret that and to use it appropriately. If you have a choice, don't expose yourself to that kind of discrimination. But if it means your livelihood or family issue is coming up, you need to know, and you need to know what other people are doing from their tests.
Interesting.
Yeah, that's very interesting. Yeah, so let's do like 2 or 3 more here, and I'll just go around. And one other quick question for you, Dr. Adrian, and then one for you, Deborah. So thank you, Dr. Groper, for the COVID-19 slide and the information that the virus can affect other areas besides the lungs. So would this shutdown of other organs be considered a secondary infection or a COVID-19 complication?
It's a complication. A secondary infection, as far as I remember, and I haven't practiced medicine since internship, so I'm not an authority on that, is an infection that comes as a result of something else. For instance, you're getting treated for cancer and you get infected with something because of that. I think what happens with COVID is that different people respond, different organ systems respond differently to the infection itself. I'll leave it at that.
All right, thank you. Yeah, so Deborah.
Yeah.
So this relates to nursing homes, right? So what remedial measures, right, can a society take for the health, comfort, and medical safety of the elderly population that we find in medical centers who are at risk for coronavirus infection, where the infection rates are so high? Are there things that we can be doing, that we should be doing, whether it's architectural and the system or specific to families and individuals themselves, that should be happening to protect people?
That's a very good question. I am not an expert at that particular aspect, but I do know, given the experience that has ensued with COVID-19, that's something that homes, long-term nursing care facilities are looking at, because it has been an issue not only with COVID-19 but the flu and other very contagious illnesses as well. So it's a serious issue with anything that has a highly contagious rate among elderly. It's a serious issue. So
yeah, I know. I've read some things recently about given penetration rates. So I live here in the New York area, but there's consideration, discussion of enforcing density constraints on nursing homes and diffusing the population. Though that's becoming, the funding for that is an enormous challenge.
Right. Yeah. If I can speak into it too, I had, I'm from New York originally too, James, and I had 2 family members actually die from COVID, which were associated with a nursing home. And so they didn't die directly, obviously, of COVID, but they died from COVID-related impacts, right? Because they were already medically challenged. But I do think that the same reasons that we saw the virus spread within dense public housing and other places where people were sort of on top of each other was the same reason we saw it spread in nursing homes. And I think it goes back to a certain extent, I think it goes back to Dr. Groper's comment in terms of the social determinants of health, and I would even say the social determinants of care, because care also has its own systemic issues related to it. There was one show I saw on Good Morning America where they did not lose a single person in that nursing home. And that was largely because they were able to keep constant the medical providers and, sort of bump up their sanitation techniques and methods. But we got to be honest about this. Elderly care is expensive. This is one of the reasons why I try to write a lot about the use of digital for, being able to supplant like some of the issues that people have in affordability. And when you have, places in the Bronx, New York, or other places that are not the high end of healthcare, or ones that Medicaid or Medicare will not pay for, you have, an equation of disaster that could potentially happen. And that happens not just and Dr. Groper, I know you can amen me on this. It doesn't happen just in nursing homes. It also happens in poorly resourced emergency rooms and hospital facilities where impoverished people tend to actually frequent. So a lot of that as well. So I think, going forward, not only do we need to think about social distancing and maybe reducing the number of care patients which are in nursing homes, but I also think we need to have this conversation around, the inequalities that come with, the last part of your life and where you actually find yourself getting care. Yeah. Right? Am I right, Deborah? Because that's a real big issue.
It's a serious issue. And what we also found is that the health workers were put at great risk in those facilities and, in some of the hospital facilities as well, in those emergency rooms as well. So
that's right. And if I can add on top of that, disproportionately, the reason that we saw high numbers of COVID patients among African Americans and Latinos is because those are frontline jobs. That tend to be lower wage. And so they were also subjecting themselves daily to situations with inadequate PPE, where they were actually prone to more infection.
Yeah.
I want to make a quick point there also, because we're talking about nursing homes versus hospitals. Deborah raises the point. The staff in nursing homes is some of the least paid people on the planet.
That's
and
right.
what that means is that it is a very non-resilient system.
That's
we
right.
saw the heroic measures that our hospitals went through all around the country and the world to react and train. My kid's a doctor and her husband, and within weeks they mobilized and trained these people and put in facilities, changed the physical landscape. You can't do that in nursing homes when there is no culture of paying these people fairly, allowing them to be educated, giving them the technology and the PPE that they need to do their jobs, and most of all here in Massachusetts, the management that they need. Where in one home that killed 85 people, where literally the top management was considered negligent, and had been considered negligent all along. It wasn't just before this.
Yes.
So I think that's a major issue when we're talking about the elderly population in the Bronx or anywhere else.
That's right. That's right.
Elder care is a crisis in this country.
Always.
That is, I think without the pandemic, it's a crisis.
Yes, it has been for a long time.
I'm going to say for some interactivity here, we have somebody who's raised their hand. So let me see. So Samuel Nixon Jr., let me enter you in and so you can ask your question. So give me a second here. Hi,
can you hear
Sam,
me?
Can you hear us?
Yes, I can hear you. Can you hear me?
Yeah, we can. Go for it.
Thank you very much. I appreciate the discussion. I wanted to just raise the question in terms of, as we talk about the country's ability to actually manage and handle information, I was going to ask, how realistically are we equipped as a nation to systematically associate or link the related specialists when we look at each citizen in the country with persons that have their medical information, their financial information, legal information, all those things that are attached or associated with individuals within our country? How are we able to actually manage that across this country in a way that's keeping it updated and current and maintain the confidentiality or security that is required, or at least that the citizen would expect or want in a way that can be guarded and kept, especially in light of what we're aware of in terms of the breaches of security and all those things that are going on. So when we talk about our social systems and managing our lives as individual citizens and going forward into this technological environment, how well is our country actually able to do that without getting into the big brother mode where it becomes a central repository that someone ultimately has to keep to everything about you?
Yeah.
So I'll take the first crack at that. We are, and it's a two-part answer. We are awful at it, and the rest of the world, however, is just as bad. And I'll explain that. The reason we're awful at it is because we know what good is in terms of specialists or financial practitioners or legal specialists. It is when you choose an expert yourself that has a relationship and a duty of what's called a fiduciary duty only to you. That's the Hippocratic Oath. That's the conflict of interest that you have with a defense lawyer or with a lawyer when you go and hire them as your representative in these things, because people cannot expect to be experts at this. And what has happened in the last 30 years as we've introduced technology is that we've introduced these digital platforms these intermediaries, these mega hospitals that you can't get away from, and not just here, but around the world, which have reduced the ability of people to choose their experts and to get independent advice, because the expert is paid by the hour for their knowledge, for their assistance, not as a matter of profit that they can squeeze out as an employee of some system or some enterprise or some institution. And I think in terms of privacy laws and digital issues going forward, and I can speak a lot about this, I think globally we are failing miserably at this with respect to technology because we're losing the ability to have trusted intermediaries work on our behalf.
Yeah, I would just say on this one, that's a tough question. And Sam, I hesitate in terms of asking or being more optimistic about a solution when I think about the partisanship that has sort of plagued COVID-19, right? The fact that we are having conversations around whether or not you should wear a mask or not, whether or not you should gather in large crowds or not. Any kind of systemic solution that you're suggesting requires leadership. And if leadership doesn't become the model for what more effective public health looks like, we're never going to get to the state where you're talking about where we do better coordination. You know, I think the fact that we already knew that we had disparate systems when it came to access to healthcare, and we already knew that we had disparate systems when it came to access to financial services and education. What makes COVID-19 worse is the fact that we knew that we had these disparities, but we don't have a central figure that's trying to find, I think, strategic and really forward-thinking ways to actually bring things together. And it's concerning. It's concerning when wearing a mask and not wearing a mask has been broken down by race. You know, that in and of itself suggests a lot about, again, the racialization of this disease and the lack of leadership, but as well as the fact that we have people who are walking around in the middle of a global pandemic, not even thinking or caring about their fellow man in ways that we should, as people who are united under one God in this country in a democratic way. So I would love to answer your question more positively. As a sociologist, it's a little bit more difficult because systemic and structural inequities, you know, really are at the heart of what we're actually seeing right now. And so until we actually, you know, either figure out ways to go towards more healing, or we essentially vote until we get someone that is a lot more reasonable and a lot more ethical in the way that they manage a country, I think we're going to be stuck where you're actually suggesting we are right now.
If I'm allowed.
All right. Well, thank you all.
Sam, I want to give you an anecdote from yesterday, unrelated to COVID, that I think illustrates Nicole's point from a different direction. The news story was about rent-to-own housing sales, which became an issue affecting lower income groups after the 2008 mortgage crisis, and are about to become an issue now because of the economic stress that Nicole, was talking about due to the disproportionate impact of the COVID. And the point there was that systemically, the people that were getting these homes, these rent-to-own homes, which were a total ripoff, and I won't go into why, were basically denied what we all expect under normal circumstances, which is a home inspection and the process of having to get a mortgage that protects you from charlatans selling you something that in one case had to be torn down within weeks because it was unlivable. And we've seen this in healthcare with respect to dental services, for example, the same thing. So what I'm saying is that we have a systemic problem which can only be solved with the kind of policies that Nicole is talking about at the very top, where we have to protect people by introducing experts that work for them as a home inspector, as a mortgage lender officer, as a dentist. And when we allow corporations, because they have this disproportionate impact on our politics, to take these people away from us, we end up with the mess that we're in.
That's right. Or if we allow algorithms to do that. That was Christina's last one. If we allow machine learning algorithms and computerized determinants to make those decisions,
That's right.
we end up in the same place because that's the society in which they're deployed.
So I guess this is the time to say thank you to all of you. God bless.
Thank you.
The speakers, and also for a congratulations to Nicole Turner-Lee for her promotion.
Yeah.
Berlin, Dr. Adrian Groper, James Robb, and Congressman Tony Cardenas, and your contributions for the webinar today, as well as supporters such as Verizon, the Mayor's Office of Latino Affairs, American Federation of Teachers, University of Ana Mendez, Future of Privacy Forum, Brookings Institution, Patient Privacy Rights, and others. And as we mentioned, any questions that you might have that has not been covered today, please send it over to us to answer them individually at dialogue.div@prodigy.net or info@dialogueondiversity for follow-up. info@dialogueondiversity.org. That's right, for any questions. And to let you all know that a calendar of webinars have been issued for the year, at least the rest of the year. And notably, in September, we will be having the annual Entrepreneurship IT Conference and the 30th year of anniversary of the organization. And the end of the year's program cycle, as usual, will be the yearly Children's Holiday Fair and gift collection on December the 12th for the immigrant communities in the metro area in Washington, D.C. Thanks again, you lovely, lovely people. And one last message to you all, and I'm sure you know, to stay safe and keep connected. And thank you for your lovely presentations. God bless you all.
Thank you, Christina. And kudos to you. Look at you. You're online on a Zoom.